nonpsychotic illness. The four major structures of the limbic system, which the limbic system is the emotional centers in the brain, are the amygdala, the hippocampus, the thalamus and hypothalamus, and the cingulate gyrus. Okay, the amygdala is about the size of an almond, and it's located in the medial temporal lobe of the brain and plays a crucial role in processing emotions. Particularly or especially fear and anxiety. The hippocampus, which is also located in the medial temporal lobe, and it plays a role in memory, spatial navigation, and emotional regulation. The thalamus and hypothalamus, overall or together, what they will help do is regulate basic drives and emotions, mostly through neurohormonal. And the cingulate gyrus, its function is regulating emotions, behavior, and pain perception. Okay, so all of these are considered part of the limbic system, which means they're involved with emotional responses to sensory input, autonomic motor function, um, emotional processing, pain processing, and other forms of behavioral regulation. Okay, some things we're going to look at is panic disorder, anxiety, obsessive compulsive disorder, post-traumatic stress, autism, and ADD, ADHD. Okay, panic. The symptoms are sudden periods of intense fear, palpitations, sweating, shaking, shortness of breath, and numbness. Medications that can help: antidepressants, benzos, and beta blockers. And treatment is counseling and medications. To diagnose, it's based on history and symptoms after ruling out other potential causes. And with differential diagnosis to panic disorder, it would be heart disease, hyperthyroidism, and drug use. A panic attack is a sudden episode of intense fear that triggers severe physical reactions when there is no real danger or apparent cause. Panic attacks are very frightening, and when a panic attack occurs, you might think you're losing control, having a heart attack, or even dying. Parts of the brain that are activated is the frontal lobe, specifically the dorsal anterior cingulate cortex. This amplifies the fearful signalings coming from the amygdala. Okay, the function of the DACC is it's linked to many cognitive functions, including learning, executive control, and self-control. It's located in the medial wall of the cerebral cortex and has connections to the amygdala, the hypothalamus, and the spinal cord. However, people that have conditions like depression, obsessive compulsive disorder, drug addictions, hyperactivity, and other dysregulations, it is considered a decreased function with the dorsal anterior cingulate cortex. The ventromedial prefrontal cortex dampens the signals coming from the amygdala. The ventromedial prefrontal cortex is part of the frontal lobe and considered to play a key role in social and moral function. It can also help with emotional regulation, decision making, other forms of social cognition, including interpreting facial emotions, self-processing, and can help with stress response. Okay, the amygdala, located deep inside the brain, is part of the emotional brain. And then there can be chemical imbalances such as serotonin, cortisol, and gamma aminobutyric acid, also known as GABAs. Other factors can include family history, mental health condition, and adverse childhood experience that can all contribute to panic disorders. Okay, here's a visual of some of the brain parts we have mentioned. So there's the cingulate gyrus, and that dorsal anterior cingulate gyrate would be located in this area. Okay, here's the basal ganglia, the thalamus, the hippocampus, the amygdala, and the hypothalamus. Okay, just to orient you here, this is the anterior aspect of the brain. Here's posterior. Okay, so this is the frontal lobe. This is the occipital lobe. There's the cerebellum. Okay, parietal lobe. So this is a lateral view of the brain. Okay, another view. This would be an anterior view, cross-section of the brain, where you can see the amygdala, the hypothalamus, all right, CBT, which stands for Cognitive Behavioral Therapy, is a type of psychotherapy that helps people manage mental and physical health problems by changing the way they think and behave. CBT is a combination of cognitive and behavioral therapy. It can help with a range of conditions, including depression, anxiety, OCD, addictions, and chronic pain. CBT is problem-oriented and focuses on current problems. The goal is to help people identify and challenge unhelpful thoughts, learn practical self-help strategies, change or modify their behavior, and have control over their thoughts, feelings, and behaviors. CBT is generally considered short-term therapy, ranging from about 5 to 20 sessions. The number of sessions depend on a number of factors, including the type of disorder, the severity of symptoms, and how quickly progress is made. Okay, some examples are: what is the situation? Okay, what triggers a problem? And then what are the thoughts about it? What's going through your mind? Am I not good enough? Would be an example. And then, is there a physical and or emotional response? So how does my body react? Do I seize up? Muscle tension? Do I get headaches? Do I feel tired? And then your own emotions on how do I feel about this, such as anxious or worthlessness. And then behavior, what do I do about it? Okay, for example, do I avoid contact with others? So in other words, there's a stimulus that is going to happen, and then how are you going to respond? Okay, so these people are taught how to have healthier responses. Okay, part of CBT is breathing. Breathing can calm you down because it activates your parasympathetic nervous system, which is responsible for your body's rest and digest function. When you breathe deeply, your brain receives a message to relax, which it then sends to your body. This can lead to a number of psychological changes, including lowering your blood pressure and heart rate, reducing stress hormones, increasing oxygen to the brain, and improve the ability to think rationally. Okay, the reason for this the reason breathing works is because you are activating the vagus nerve or cranial nerve 10. It's a very powerful parasympathetic nerve. Okay, so you can see the nerve here, so it's the yellow one, and you can see that it goes all over. I mean, this is so the word vagus means vagabond, which means wanderer. So this nerve wanders and innervates a ton of stuff in the body. Your throat area, the lungs, the heart, the digestive system, your breathing. So when you stimulate the diaphragm and then stimulate the lungs, you are activating the vagus nerve. And so you're making it fire, you're making it synapse. And since it is a very powerful parasympathetic nerve, it is going to start to put you in the calm effects. So in CBT, that's one of the first things they teach people is to start breathing. And it is the intervals of breathing. And an example of that would be take about 8 seconds in to take a deep breathe in as far as you can for about 8 seconds, deep breath, and then you blow out for 8 seconds as far out as you can. So breathe in and breathe out. So it's those intervals that seem to matter. Okay, so deep breathing, whatever seconds you pick, make sure it's 6 seconds in, 6 seconds out. Or if you pick 7 seconds, that's fine. 7 in, 7 out. Okay, anxiety. Experiencing occasional anxiety is a normal part of life. However, people with anxiety disorders frequently have intense, excessive, and persistent worry and fear about everyday situation. Often, anxiety disorders involve repeated episodes of sudden feelings of intense anxiety and fear or terror that reach a peak within minutes, causing panic attacks. Examples of anxiety disorders include generalized anxiety, social anxiety, and separation anxiety. Common anxiety signs and symptoms include feeling nervous, restless or tense, having a sense of impending danger, panic, or doom, having an increased heart rate, breathing rapidly, sweating, trembling, feeling weak or tired, trouble concentrating or thinking about anything other than the present worry, having trouble sleeping. By the way, all this is activating the sympathetic nervous system, which is your fight or flight. And then experiencing gastrointestinal problems, having difficulty controlling worry, and having the urge to avoid things that trigger anxiety. Causes of anxiety disorders aren't fully understood. Life experiences such as trauma or traumatic events appear to trigger anxiety in people, especially those already prone to it. Medical causes. For some people, anxiety may be linked to an underlying health issue. In some cases, anxiety signs and symptoms are the first indicators of a medical illness. If your doctor suspects your anxiety may have a medical cause, the doctor may order tests to look for signs of a problem. Examples of medical problems that can be linked to anxiety include heart disease, diabetes, thyroid problems like hyperparathyroidism, respiratory disorders such as COPD and asthma, withdrawal from alcohol or anti-anxiety medications or other medications or drugs, chronic pain, and irritable bowel syndrome. Complications. Having an anxiety disorder does more than make you worry. It can also lead to or worsen other mental and physical conditions such as depression, substance misuse, trouble sleeping, which is insomnia, digestive or bowel problems, headaches, chronic pain, social isolation, problems functioning at school or work, and poor quality of life, and suicide or suicidal thoughts. Okay, with prevention, there is no way to predict for certain what will cause someone to develop an anxiety disorder, but you can take steps to reduce the impact of the symptoms if you're anxious. So get help early. Anxiety is harder to treat if you wait. Stay active. Participate in activities that you enjoy. Enjoying social interactions and caring relationships. which can lessen your worries. Avoid alcohol or drug use, as these can cause or worsen your anxiety. Okay, what causes a dysregulation in the nervous system? A dysregulated nervous system can be caused by many factors, including trauma, such as physical or emotional abuse, child neglect, natural disasters, losing a loved one, stress, chronic stress from a toxic work environment or a pandemic, or short-term conflict like an argument can dysregulate the nervous system. Other life events, such as exposure to toxins, significant life change, physical illness, personality traits like perfectionism or other personality styles, blood sugar unbalanced, blood sugar levels can impact the nervous system, and substance addiction such as alcohol or drugs can contribute to a dysregulated nervous system. A dysregulated nervous system can lead to a variety of physical and psychological issues, including increased feeling of anger, impulsivity, racing thoughts, and defensiveness, numbness, increased depressive moods, impaired cognitive processing, emotional dysregulation, sleep problems, and digestive issues. Your nervous system needs to purge by letting the thoughts come out via talking. Okay, I'm going to put an asterisk by this because this is very important. Now, you'll need to understand that the human body has ways of letting you know something isn't right. Here's an example. If you eat bad chicken, your stomach will let you know that this is bad, and it will let you know it's going to get rid of it. There's just that feeling of nausea and vomiting, and that is your body's way of purging the bad chicken that's in your stomach. If you have a headache, that is your body's way of letting you know that you're dehydrated. Okay, so one example of headaches can be dehydration. So when it comes to anxiety, that is your nervous system letting you know that something is going on, something needs to be addressed. And what happens is, okay, one of the reasons, not the reason, not the only reason, but one of the reasons for anxiety is unspoken words. So, in other words, something happened in youth, something happened wherever or whenever, and the person isn't talking about it. They try to suppress it, they try to ignore it, dodge it. If it's ever brought up, they get defensive or they just leave. And sometimes these traumas or unhealthy things or whatever happen many, many times. It's, not just a one-time thing. It happens many times for people over a long period of time. And so, but the person holds it on the inside, and that can contribute to anxiety. So one of the things that's really good, or a good start to overcoming anxiety, is by talking about it. That is how the nervous system purges. And this is one of the reasons why people keep themselves so busy, is because they don't want to have a quiet time. They don't want to have to think about the past. They don't want these things to surface. And so they just stay busy. And when they do start thinking about it, then it gives them anxiety. And then they go to the ameliorating thing, whether it's drugs, alcohol, workaholic, over exercising, video games, social media, it doesn't matter. Just something to check out because they don't want to deal with it. They don't want to talk about it. There is disharmony in the limbic system. If you do not get it out, it manifests into anxiety and other psychological conditions. Example of body awareness. when we eat bad food. There's the nausea and vomiting when we're dehydrated. We get the headache, dry skin, and dry lips. When we're tired, we go to bed. The nervous system, its feeling is anxiety. That thought that's on your mind, it keeps you up, it's on your mind. Well, why the thought? Well, it's designed to address it. That's how the nervous system heals. Exercise and anxiety. Here is a reference if you want to cut and paste that. In other words, what I'm about to talk about is cited. Exercise programs are a viable treatment option for the treatment of anxiety. High-intensity exercise regimens were found to be more effective than low-intensity regimens. The results have implications for the use of exercise schemes in general practice. So in other words, exercise can be helpful for your anxiety. In another study, exercise versus medications and anxiety, multiple studies have demonstrated that acute exercise results in decreased anxiety, regardless of whether participants were administered naltrexone, an opioid receptor blocking medication, or placebo. Okay, and here is the reference for that article. Physical activity is 1.5 times more effective at reducing mild to moderate symptoms of depression, psychological stress, and anxiety than medication or cognitive behavioral therapy, according to the study's lead author. Here is the reference for that article. Okay, the power of positive versus negative thinking. The 5-to-1 ratio. So it was a 30-year study done by Dr. John Gottman. For every negative thing said or done, you must say or do 5 positive things to override and heal the one negative. That is how powerful negative thoughts, statements, and actions are. For every negative thing that you do, you've got to do 5 things to overcome that one negative thing. So the goal is to reduce negative things said or done and increase positive statements. So for example, if you say something negative to your partner, then it would take 5 positive things to heal that. If you say something negative about yourself, it takes 5 positive things to heal that. So an example would be, I suck at life, I suck at this test, I'm going to fail this test. Well, that's 3 things right there. So that's now 15 positive things I have to say to override the negative things that were said. Okay, that's just letting you know how powerful negative statements are, so you want to try to avoid them. Psychological and physiological effects in plant growth and healing by using positive and negative words. So you're probably like, well, what the heck are you talking about plants for? Well, plants are a living organism. And so there was a study done, and here's the reference right there from the Journal of Innovative Research and Technology. So what happened was these researchers said, essentially, let's see what happens when we take these plants and have people curse at them. And then over here, we're going to have plants and we're going to have people bless them or say kind things to them. So plants that were spoken kindly to thrived. The same species of plants that were spoken to negatively died. The power of words is a thing. Negativity is harmful. Positivity is helpful. So I would hope to encourage you all to really keep this in mind and really do the best you can to avoid negative thoughts and stick with things that are positive. Okay, obsessive compulsive disorders, also called OCD. Okay, this is excessive thoughts, there's the obsession, that lead to repetitive behaviors, there's the compulsion. Obsessive compulsive disorder is characterized by unreasonable thoughts and fears, that's the obsession, that lead to compulsive behavior. Okay, OCD often centers on themes such as the fear of germs, the need to rearrange objects in a specific manner, compulsive behavior, compulsive hoarding, meaningless repetition of one's own words, repetitive movements, ritualistic behavior, and social isolation. Treatment includes talk therapy, medications, or both. Medications like SSRIs, antidepressants, and other anxiety medications, and therapies like support groups, cognitive behavioral therapy, aversion therapy, psychoeducation, rational emotional behavior therapy are some examples of other things that can help. The OCD traits may have developed a sort of coping mechanism to avoid punishment in an effort to be perfect and obedient. It is a form of control the person has, since they may not have had control over other areas in their life, such as in childhood. Multiple parts of the brain are involved in OCD. The orbitofrontal cortex, the anterior cingulate cortex, the caudate nucleus, the thalamus, the insula, the posterior medial frontal cortex, and the ventral medial frontal cortex. Okay, the OCD cycle is there's some sort of anxiety that creates the compulsion that offers some relief that reinforces the obsession. Okay, here is the anatomy of some of those parts we just mentioned, the orbitofrontal cortex, the medial prefrontal cortex, the anterior cingulate cortex, the thalamus, and so on, just to give you an idea of where these things are located. If you want to geek out in inhibitory interactions and normal excitatory leading to corticostriatal thalamocortical circuit, there's this chart here for you, and then, you can read this more advanced stuff. Now, another thing that is not helpful for a person with any kind of brain disorder, even if you have a perfectly healthy brain, the following you want to do the best you can to avoid, and that is pro-inflammatory foods. If you have a brain pre-existing condition, consuming pro-inflammatory foods is going to take a bad situation worse. Okay, so things like avoiding fruit juice. Okay, people think it's healthy, but the problem is it's too much sugar. And the dietary sugar in this case has been linked to increased symptoms of anxiety. Sodas and soft drinks, they have a lot of sugar. They're very high in sugar. There's also additives in them. They can increase hunger, decrease satiety. Candy. So these are typically quick pick-me-ups, or people just enjoy them, and it's mostly because of the sugar. Obviously sugar is addictive, and so people will consume them. Increased sugar is linked to anxiety. Caffeine, which promotes wakefulness and activity. However, in some people, it can contribute to anxiety. So as a general rule, you want to try to keep your caffeine intake to about 200 to 400 milligrams or less per day. So that would equal roughly about 1 to 2 cups of coffee. The energy drinks that have caffeine in them, they also have a bunch of other energy ingredients in them, so you'd have to be careful about that. Processed foods, pro-inflammatory, so processed meats and pastries and anything that's packaged or ultra processed is linked to depression and anxiety. Food additives like MSG and food dyes, things that are man-made and synthetic, designed to enhance taste, can cause inflammation and therefore cause anxiety or contribute to it. Sugar alternatives. They can contain aspartame, and aspartame has been shown to increase cortisol levels and slow down digestion, which could increase to anxious feelings. White breads cause a spike in blood sugar and then a crash. And so that spike in blood sugar can contribute to anxiety. Energy drinks and all their ingredients is risky. It can enhance a person's anxiety or whatever mental state they're going through. Alcohol. An occasional drink, a glass of wine for dinner, is usually fine for most adults. However, each of us metabolize alcohol differently. Some people cannot tolerate any alcohol, or else it makes them anxious. Autism. Autism, or autism spectrum disorder, refers to a broad range of conditions characterized by challenges with social skills, repetitive behaviors, speech, and nonverbal communication. According to the CDC, autism affects an estimated 1 in 36 children and 1 in 45 adults in the United States. And those numbers seem to be climbing, so getting worse. The term autism was first used by a guy named Eugene Buehler around 1908. He used it to describe a schizophrenic patient who had withdrawn into his own world. The Greek word autos from autism means self, and the word autism was used by Buehler to mean morbid self-admiration and withdrawing or withdrawal within self. Causes of autism. It is a complex and often contentious discussion. Each researcher has their own input as to why one gets autism. So I'm going to share with you all the different things that all the different people have said as their opinion on autism. So we're just going to cover the entire gamut from A to Z, and also consider that it is likely a little bit of all the above. Okay, so for example, is it only genetic, or is it genetic and epigenetic, or is it from chemical exposure such as air pollution, pesticides, BPA, phthalates, mercury, lead, nutritional deficiencies such as folic acid, vitamin D, and essential fatty acid, smoking, tobacco, and alcohol? Or is it all the above that we just mentioned? Autism can be in utero. Here is the article, the site for that. Prenatal exposure to common environmental factors affect brain lipids and increase the risk of developing autism spectrum disorder. Okay, I'm going to say that one more time. Prenatal exposure to common environmental factors, so there's your environmental toxins, affect the brain lipids. The brain is made of fat. And a lot of these chemicals and environmental toxins and all that can cross into the brain, especially at the prenatal age because they have an immature blood-brain barrier. So if that happens, it increases the risk of developing autism. A baby in utero and newborns, this barrier is immature or leaky, rendering the developing brain more vulnerable to drugs, toxins entering circulation from the mother to baby via the placenta. Okay, here is an article. It's the research article on that. After birth, anything administered to that baby crosses the blood-brain barrier. Anything administered to that baby will cross the blood-brain barrier. There's no way around it. It's immature. Anything that gets inside of that little body is going to get into the brain. Prenatal disruption of blood-brain barrier formation via cyclooxygenase activation leads to lifelong brain inflammation. This study demonstrates that maternal inflammation during pregnancy perturbs the blood-brain barrier formation via cyclooxygenase activation in fetal microglia, leading to abnormal cerebrovascular function and chronic brain inflammation persisting across the offspring's lifespan. So in other words, once this happens, once the brain gets inflamed, whether it's in utero or after birth, or immediately after birth, that's a lifelong issue. Okay, that's a permanent, irreversible injury. Therefore, developmental disruption of the blood-brain barrier formation could be an important etiological factor contributing to the pathology of neurodevelopment disorders. Okay, and there is the research article that talks about that. Mercury. Examining the evidence that ethyl mercury crosses the blood-brain barrier. And there's the research article that talks about that. Aluminum, which is found in vaccines. Infants receive about 4.4 milligrams of aluminum in the first 6 months of life from the vaccines. Crosses the blood-brain barrier. And if you want to geek out, the quantities of aluminum in vaccines, so below is listed the vaccine and how much aluminum is in them. So how much is in the pneumococcal vaccine, the Tdap vaccine, and so on. Okay, so this is a lot of stuff. I'm not going to go over it verbatim, but that information is here for you so you can see how much aluminum is in all these different vaccines, the HPV vaccine, the Hep vaccine, and so on. The Tdap. Okay, infant formula also has aluminum in it, as does their soy-based formulas. Okay, injection versus ingestion of aluminum. A higher concentration of aluminum gets into the bloodstream via injection and travels to the brain. The stomach and the liver and all that has been removed from the equation. If you bypass the stomach, so injection, the aluminum gets to the brain quicker. And because of that immature blood-brain barrier, it is not protective enough to keep the metals out of the brain. Other ingredients: antigens, aluminum, formaldehyde, gelatin, thimerosal, human fetal cells, animal cell lines, in other words, the DNA from animal parts, blood products, egg or chicken products, antibiotics, yeast, formaldehyde, polysorbate 80, ethanol, acetone, thimerosal, benzothymine chloride, glutaraldehyde, aluminum phosphate, sulfate, human serum albumin, animal DNA, and phenyl carbolic acid are other ingredients that get into the baby and will cross the blood-brain barrier. Okay, and these things are usually found in vaccines. Fetal brain immune activation. So here is the maternal placental immune activation. So you increase the inflammatory response. You have altered neurotransmitters such as dopamine, serotonin, and melatonin. You'll get an increase in oxidative stress, microglial priming. So microglia is one of the glias of the brain, right? You have your astrocytes, the microglial cells, the ependymal cells, all these cool cells that are found in the nervous system. You get an impaired synaptogenesis, so the synapses, so one nerve needs to fire or synapse on another nerve. That gets impaired when all these chemicals cross the blood-brain barrier. And then you get altered neuronal migration and an impact on axonal targeting. All this creates an altered neurodevelopment, so the brain is hurt. It's one of the reasons why we're seeing so many different behavioral things in our youth these days. Offspring neurodevelopment outcomes, things like attention deficit and hyperactivity disorders, autism, anxiety and depression, intellectual disability and schizophrenia are some possible side effects from all these chemicals crossing into the brain. So here we have a mature blood-brain barrier. Okay, you can see that there are there's no gaps, there's no openings, there's no spaces. But over here in a infant's blood-brain barrier, you can see the openings, okay, making the brain vulnerable. In fact, the mother's breast milk has all these cool ingredients, including cholesterol, that is actually synergistic to the brain. It promotes brain health, promotes brain growth, sets that brain in motion. So that's one of the reasons why it's believed that the blood-brain barrier is open, and it's to receive all those healthy ingredients to begin a healthy formation of the brain from mother's breast milk to baby. Okay, but sadly, in our modern times, babies are a lot of these synthetic and man-made and ingredients that we just covered a minute ago are also put into the baby and end up crossing the blood-brain barrier. Okay, and what this does is it increases exposure of vulnerable and immature to the immature central nervous system. Okay, here's another brain neuroanatomy diagram here that shows you what happens. So we're supposed to have tight junctions. Okay, and then there's neurons that will synapse onto another neuron. However, these neurotransmitters, as you can see here, you need a neurotransmitter, then you also need a receptor. Those things can become damaged because of the chemicals that enter and cross that blood-brain barrier. The diagnosis of autism: your child's doctor will look for signs of developmental delays, at regular checkups. If your child shows any symptoms of autism, you will likely be referred to a specialist. Because autism varies widely from symptoms and severity, making a diagnosis can be difficult. Okay, treatment. There's no cure that exists for autism, and there's also no one-size-fits-all treatment because everybody's different on where they're at on that spectrum. However, the goals of treatment is to maximize the child's ability to function by reducing the autism symptoms, by supporting the development and learning and intervening and working on social skills, communication skills, functional and behavioral skills. Treatment options may include behavior and communication therapies, educational therapies, family therapies, and other therapies depending on the child's need. Medication may be involved. Okay, managing other medical and mental health conditions. In addition to autism, children, teens, and adults can also experience medical health issues such as epilepsy, sleep disorders, limited food preferences, stomach problems, problems with transitioning to adulthood. Teens and young adults with autism may have difficulty understanding body changes. Social situations may become increasingly complex in adolescence, and there will be less tolerance for individual differences. So, in other words, people tend to have a lot of grace and freedom to behavior issues when you're really little, like age 2, age 5. But once you're like 16, 17, 18, it gets a little different, right? Socially. If you're 25 or 35, right, there are certain expectations because of the age. So these behavior problems may be challenging, especially during the teen years. Other mental health disorders with teens and adults with autism, they can experience anxiety and depression. So planning for the future. So children with autism typically continue to learn and compensate for the problems throughout their lifetime. And it's important to have that support to plan for the future, including employment, college, living situation, independence, to try to make this process smoother. With alternative medicine in autism, some parents seek alternative or complementary therapies. Things like creative therapies, so intervention with art therapy or music. Sensory-based therapies, such as balance and hearing, because some might have these sensory neural problems, so they have problems tolerating things, and so getting the balance in hearing, such as things like squeezy toys, trampolines, and other things that can help with the senses. Pet or horse therapy. Pets can improve companionship and recreation. Special diets. And I am a firm believer that if you can keep pro-inflammatory foods away from someone, especially if they have a pre-existing condition like autism, it is helpful. And vitamins and supplements and probiotics, those can help. Acupuncture can also help. Usually that calms people down, kind of resets the nervous system. Chelation therapy. This is designed to remove the metals from the body, so the mercury and other heavy metals. Hyperbaric oxygen chambers. Increasing oxygen in people has been known to improve some mental health. And intravenous immunoglobulin infusion. and that essentially would help boost the immune system and boost gut function. Okay, coping and support. So raising a child with autism. Uh, the family or the parents would need to find a team of trusted professionals, social workers, teachers, therapists, case managers, keep a record of visits with the service providers, learn more about the disorder, take time for yourself. That's one thing that sometimes parents are guilty of is they just experience burnout because they're constantly attending to the special needs of someone. So don't forget to take some time out for yourself to avoid burnout. You can talk with other families of those with autism to see what they're doing that works. Also helps just to talk about it and navigate through it, and constantly keeping up with new technologies and therapies that might be helpful. Okay, next condition is ADHD, or attention deficit hyperactive disorder. ADH is caused by an underlying neurobiological, metabolic, and functional disorder in the brain. Significant anomalies in the neurotransmitter system in the brain were detected in examinations of affected persons. Such anomalies are triggered by an imbalance of neurotransmitters, dopamine and noradrenaline, which play an important role in the transmission of the stimuli in the nerve cells. Now, those are also found in the sympathetic nervous system, your noradrenaline. So these neurotransmitters are out of balance, faulty. Processing will result in the affected areas of the brain. ADH and the role of genes. In some families, ADH occur in clusters, which allow the assumption that there is a genetic predisposition. Okay, social environments and ADH. To what extent ADH manifests itself also depends on psychosocial factors, like a child's living conditions. Negative impacts may be, for example, the lack of structured daily routine. Other factors that may encourage ADHD: premature birth, alcohol, nicotine, and drug consumption during pregnancy, lack of exercise, environmental toxins, and side effects of chemicals and medications, especially those that can cross the blood-brain barrier. How to detect ADHD? In infants, possible indications such as instability, avoidance of bodily contact, eating and sleep disorders, restlessness. In toddlers, heightened urge of activities, little perseverance while playing, defiant behavior, locomotor disorders, and problems building up stable friendships with other children. And then primary school children, some possibilities are the child cannot sit still, disturbs the classroom, problems with homework, can be easily distracted, easily irritable, quickly frustrated, poor concentration. In adolescence, increased attention deficit disorder would be things like lack of self-organization, increasing themselves to strong stimuli such as loud musics and video games, achievement or performance rejection, aggressive behavior, lack of social competence, and contact with drugs. An elementary age male typically has an attention span ranging from about 12 to 30 minutes. Okay, so this is normal for this age, 12 to 30 minutes, with a general rule of thumb being that a child can focus for roughly 2 to 3 minutes per year of age. So, sitting all day long in a classroom is usually not helpful, and the child will want to play and is often misdiagnosed as having ADHD because they just won't sit there and stare at a board all day long for 8 hours. Boys are diagnosed at a greater rate than girls, according to this article here. Kinetic learning. Elementary age kids can learn better through kinetic learning, which involves physical activity and hands-on learning. Improved retention. Kinetic learning can help kids remember more of what they learn because they're applying the techniques as they learn them. Better critical thinking. Kinetic learning can help with that. Increased engagement. Movement can improve focus and energy levels. Treatment for ADHD in children depend on the child's age, symptoms, and overall health. Common treatments include behavior therapy, medications, school-based programs, supplements such as magnesium, and ADHD does not have a cure, but treatments can help reduce symptoms and improve function. It may take some time to find the right treatment for your child or a person with ADHD. Folate in the brain. What happens if your brain does not process folic acid properly? And by the way, folic acid is found in just about everything. This is lab created, and therefore you should not take folic acid, but rather you want folate. So when you look at your supplements or food that is fortified, you want to make sure it's folate, not folic acid. Okay, about 44% of our population has a genetic problem processing folic acid. Okay, we'll talk about that in a second. Okay, without the functional PCFT, cells in the small intestine cannot absorb folates from the food, and cells in the brain, okay, and the brain cannot transport folate to the cerebrospinal fluid. These folate deficiencies result in digestive issues, neurological problems, and other signs and symptoms of hereditary folate malabsorption. Okay, so folate versus folic acid, which is vitamin B9. You should never take folic acid. Rather, take folate. Folate is a natural B9, and folic acid is a lab-created B9. The MTHFR gene, which stands for methyl tetrahydrofolate reductase, it's an enzyme, provides instructions for the body to make an enzyme that helps process folate, a B vitamin that is essential for healthy growth and development. The MTHFR gene provides instructions for the body to make the enzyme, which the enzyme is this, which is methylene tetrahydrofolate reductase enzyme, which helps the body break down and use folate. Okay, so for short, we say the MTHFR gene. Folate is a B vitamin that the body needs to make DNA and modify proteins. Folic acid is the man-made form of folate. Okay, one reason, by the way, why there's so much postpartum depression is because of folic acid being in prenatal vitamins. So please hear me out on this. I'm going to say something, and there's no reason to not do this. Look at your supplements. If it says folic acid, do not take it. Make sure you get a vitamin or supplement, in this case your prenatals, that has folate in it, not folic acid. If a mom-to-be takes a prenatal with folic acid, she is going to increase her chances of getting postpartum depression. So don't do it. Okay, and please pay that information forward to yourself, to your friends and family, and to your patients. Okay, and by the way, you can fact check this. It's all over the internet. The difference between folate and folic acid, okay, and the MTHFR gene, and so on. All right, folate is the MTHFR gene variants. So gene variants are changes in the DNA sequence that make people unique. People inherit 2 copies of the MTHFR gene, 1 from each parent. And by the way, you can test for this. So this is one thing I do in my clinic is I do genetic testing, including the MTHFR gene. And sometimes they come back positive. I have a 44% chance, which is almost half, that the person that I'm working with that has all these problems and I'm trying to figure out what's going on and we do genetic testing, I've got a very good shot that it's going to come back positive. Okay, MTF, and so what that means is if you have a positive finding for the MTHFR gene variant, you are legitimately allergic to folic acid and it will hurt your brain. Don't do it. Do not take folic acid. Those people that have the positive gene finding will have to take what's called methylfolate. Okay, so there's folate, which is vitamin B9. That one you can take if you have a normal gene. Never take folic acid. If you have a positive finding for the MTHFR gene variant, you cannot take folate and you cannot take folic acid. So what they have to take is called methylfolate, specifically engineered for people with this gene variant. Okay, ADD or attention deficit disorder is a term used for people who have excessive difficulties with concentration without the presence of other ADHD symptoms. Okay, by the way, that gene mutation, there are home tests you can get, so you can go online and get these and send them in. So this one is using your cheek cells. I do blood. So in my office, if we were to test this, I prefer doing a blood biopsy and sending the blood out for a lab versus the cheek swab. I just think the blood is more reliable. Okay, characteristics of ADD, being easily distracted, difficulty following directions, difficulty staying on task, forgetfulness, losing personal items such as keys or books, not paying attention to details, problems staying organized, and a short attention span. The treatment is similar to ADHD, so medications, so stimulants, non-stimulants, antidepressants, and then non-medication based would be like behavioral therapy, psychotherapy, social skill training, and support groups.